Magandang umaga sa lahat ng nakatutok sa ating kapihan ngayong umaga. Sa ating mga kasamang experts, sa mga kaibigan sa media, mga kapwa-kawani sa sektor ng kalusugan at sa lahat ng nakatutok at nakikinig sa atin ngayon. Isang huwana mula sa kagawaran ng kalusugan, malusog na umaga po sa inyong lahat. Ako po si Nikki Nesasario, ang moderator ng ating kapihan ngayong umaga. At para sa araw na ito, our experts will discuss how we are moving towards endemicity. So inaanin na natin ang naging bunga ng ating masigasig na COVID-19 response dahil patuloy at halos 100% na tayong nakabalik sa ating araw-araw na pamumuhay kagaya noong pre-pandemic. Ngunit alam nating naririyan pa rin ang COVID-19. Ano na kaya ang magiging kapalaran natin sa mga darating na buwan? Paano ang magiging sitwasyon ng pandemya sa Pilipinas at sa mundo? Paano natin ito malalampasan at ano nga ba ang ating mga dapat na gawin? Kaya naman para pag-usapan ng mga bagay na ito na posibleng makatulong at magbigay unawa sa mga nakikinig sa atin ngayon, we have with us today DOH Epidemiology Bureau Director, Dr. Alethea de Guzman, to talk about the latest COVID-19 situation and the alert level system. We also have Dr. John Wong, co-founder and senior technical advisor ng Epimetrics Incorporated, to talk more about the current COVID-19 trends and projection while living with the COVID-19. And we also have Dr. Edsel Salvania, member ng DOH Technical Advisory Group, to synthesize the discussion and to provide his insights and expertise on current scenario, ways of protection, and key reminders and messages on living with the virus. So before po tayo mag-umpisa ng ating discussion, here are some house rules to ensure smooth flow of the session. Everyone is encouraged to, number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement for the media partners. Number 2, pay attention to the discussion of our health experts and resource persons. Number 3, keep microphones muted while speakers are discussing and presenting. Next slide, please. Should you have queries, participants should signify and send questions sa ating Zoom chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by questions sent sa ating Zoom chat box, and every participant is advised to reserve questions. Again, we remind po that only questions related to the topic discussed will be entertained. We would highly appreciate you joining us until the last part of our session for the key messages of our speakers. So hindi na rin po nating patatagalin pa. To start our discussion, please welcome Dr. John Wong. Doc, good morning po.
Good morning. May I have my slides? Okay, thank you. So, as the cases start to go down, people are thinking about whether or not the virus or the pandemic has become endemic. So let me just give a few points about how to think about endemicity. Next slide. So let me start with key messages. So endemicity is not something that would just happen on its own. This is something that we need to work toward. It needs active involvement from us. Second, government and society will be the ones to decide what is acceptable burden of disease before we declare this to be endemic. So what is the work that we need to do to end the pandemic? It's vaccination, ventilation, and primary care management of comorbidities. Let me give some details on each of these points. Next slide. So we have our two graphs of cases per day and deaths per day. We also have the DOH dashboard on hospitalizations on the lower right. So if we look at this graph now, we may think that cases are low now, but we're actually missing a lot of cases. As we know that Omicron is very mild, so a lot of cases are asymptomatic. Some people get a little sniffles, they don't bother getting tested, or if they're suspicious that they have COVID, they just test at home using an antigen test. So we're actually missing a lot of cases. So following cases is no longer a good way to track the pandemic. Instead, we should be looking at hospitalizations and deaths. And if we look at the two graphs at the bottom, we see we get a clearer picture, no, that hospitalizations are still high, no, deaths are still there, no. So we still need to worry about how the virus, no, can mutate, no, and come back stronger, no. Next slide. So if we look at just hospitalizations and deaths, no, because cases have become unreliable, we ask that question, no, what is endemic, no, and are we headed towards it, no? Although endemicity, no, is a epidemiological concept, no, it's actually vaguely defined in epidemiology, no. We say that cases, hospitalization, or deaths are lower, but it also means that they will become persistent, no, and continuous, no, meaning an endemic disease is a disease that is with us forever, no. Probably as an example, no, of an endemic disease, no, we can look at TB, no. So TB has been with us for centuries, no, since the Spanish times, no. Here we see the mortality from TB, no, over the past 20 years, no. If we just focus on the last 5 years before the pandemic, no, 2015 to 2019, this is about maybe 25 cases, no, per 100,000 population, no, or about 27,500 TB deaths per year, or 75 deaths per day, no. So at this level of deaths, no, we still call TB an endemic disease, no. We've never declared a public health emergency, no, for TB, no, with this number of deaths, no. So this is an example of when of diseases that we consider endemic. Next slide. Can you go back? I think there's a missing slide. Oh, there. Okay. So maybe one way to think about endemicity is when will hospitalizations and deaths be acceptable? No, acceptability is the decision of both government and society. No, so for example, as we said, no, TB mortality is currently, or in pre-pandemic times, no, 27,500 per year. No, over the past 2 years, 2020 and 2021, we had an average of about 61,000 COVID deaths. No, this year we'll probably end the year with about 14,000. No, so for the first time, it will be below the TB mortality. No, so government will have to decide, no, whether this is an acceptable threshold. No? With regards to society, you know, people will show whether this is acceptable or not by their behavior. No? So, for example, will they go for vaccination? Since the lifting of the masking mandate, no, I see that a lot of people still continue to wear masks. No? So probably there's still some apprehensions, no, about COVID. No? Next slide. Next slide, please. Okay. The second factor is immunity. No, how much immunity do we have, no, to prevent death and hospitalization? No? So here, this is a modeling estimates done by the Institute for Health Metrics and Evaluation, no, at the University of Washington. So they've estimated that about 76% of the world's population has been infected with the COVID virus. No? The reason we don't see that many cases in our case counts is that they also estimate that only about 3% of infections are detected. No? So here we see that most of the world, no, is about 80 to maybe 70 to 90%. If you look at the Philippines, no, we're at about 90%, no, of the population infected. No? What stands out here is China. No, it's about 10 to 20% of the population has been infected, no? And we can understand why, no, because of their zero COVID policy, no. But it also means that they're in a very precarious position now because there are a lot of protests, no, going on now. No? So if we look at our own immunity, no, we have vaccination-induced immunity, but we also have infection-induced immunity. No? But infection-induced immunity is unreliable, no? Because if we just receive a small infective dose, no, we may not develop immunity, or that immunity may not be long-lasting. Next slide. So because of this, no, we still have to focus on immunization. No? We're currently only at 64%. No? Some people are boosted, no? But the primary focus should be on getting the 35%, no? Their primary series, no? Because these people have the most to gain, the most to benefit, no? Kasi they're starting from zero. Next slide. So since the lifting of the masking mandate last October 28, no, we saw a slight increase, no, in the number of cases, no. Although this has plateaued, no, or started to go down, no, we might see another spike or surge, no, because of the Christmas gatherings, no. So if we're not requiring people to mask, no, and they'll be indoors and with their mask off, no, because they're eating, no, for Christmas gatherings, no, then we need to improve ventilation. No? So homeowners, no, owners of buildings, no, need to improve their ventilation, and government needs to enforce, no, the indoor air quality standards, no, more strictly. Next slide. The last thing we need to do is to take care of our people, no, who have comorbidities. No? So this is a graph of excess deaths, no, in 2020 and 2021. No? So these are the deaths in excess of the average deaths, no, pre-pandemic. No? So COVID being a new disease, no, we had 123,000 deaths in those 2 years. But there were actually more deaths, no, excess deaths due to non-COVID conditions, no, primarily chronic conditions or non-communicable diseases, no, more deaths from these conditions, no, than COVID deaths, no. So for heart attack, 76,000; for diabetes, 22,000; stroke, 17,000; and hypertension, no, 13,000. No. So these are not the deaths due to these conditions. These are already excess, no? Meaning there were 76,000 more deaths over the past 2 years than the average, no, of the past 5 years. No? And the reasons for this were many of these people could not access healthcare, no, or they were afraid to go to the hospitals or see their doctors, no, when they were sick. No? A lot of these also were undiagnosed. No? For example, during the vaccination campaign, no, we only found 2/3, no, of the A3 group, no, the people with comorbidities. So what we need is to build a better primary care system, no, so that people can go for routine screening. No? Their comorbid conditions can be discovered, no, or diagnosed, no? And then manage over the long term, no? Because these are chronic conditions. But we also have to work at addressing the risk factors, no, or the causes of these chronic conditions. So these are diet, no, exercise, pollution, smoking, and alcohol intake. Next slide. So let me end by saying that health is a shared responsibility. No? It's not just the responsibility of the individual. No? Because if that were true, that health is just an individual responsibility, then there will be no need for institutions like PhilHealth. No? Because if you say that is an individual responsibility. Then if you get sick, then you pay for your own health care. But from this pandemic, we have seen that what other people do, what government does, affects a person's health also. So it's not just the responsibility of one person. So we need to encourage people to get vaccinated. We need to get other people to screen themselves, for chronic conditions, and then we need to behave in such a way that we also do not cause harm, to other people, by masking whenever there are people who are vulnerable, or to get vaccinated, if we're still not vaccinated. Thank you.
Maraming salamat po, Doc Wong, sa pagpapaliwanag ng kahulugan ng endemicity. And now to present on the current COVID-19 situation and the alert level system, Doc Thea, the floor is yours po.
Thank you, Nikki. Good morning to our media partners, Dr. Wong, Dr. Edsel, and of course to our comms unit. So, next slide, please. For this presentation, I'd like to start off by quickly going over, and siguro pagpapaalala kung paano tayo nag-transition in terms of our COVID-19 response goals. Tayo ay nagsimula na ninais natin na ma-eliminate ang COVID at magkaroon tayo ng tinatawag natin na zero case or zero incidents. Pero as we went through this pandemic, nakita at nagbago ang ating goal to minimizing these cases and minimizing transmission so that our cases will not overwhelm our health system capacity. Pero ngayon, with vaccination, therapeutics, improved healthcare capacities, ang ating current goal is not really minimizing cases, rather focusing on how we can reduce or maintain a low number of hospitalizations, as well as further reduce our fatalities, especially doon sa mga high-risk individuals natin, and these are of course our elderly and those with comorbidities. So this is how we have actually started and now transitioned, revised our goals for this COVID-19 pandemic response. Next slide, please. So bakit meron tayong pagbabago sa goals na ginagawa? In this graph, meron tayong ilang bagay na gusto nating ipakita. Una, mapapansin natin, the black lines which are representing our cases, ang alpha at beta, and these are the first two peaks, are actually resulted to almost the same number of cases. Pero kung titingnan natin, yung numero ng hospitalization for these two peaks, mas madami ng kaunti ang ating nangyaring hospitalization para sa Delta natin, which was around September of 2021. It is actually the variant of concern, which led to the highest number of admissions and the highest hospital occupancy rates across the pandemic. Nung dumating ang Omicron, and this is the third peak, it resulted to the highest number of cases. Pero kung mapapansin natin, ang dami na naging hospitalized or admitted, though tumaas din siya, ay hindi na kasing laki or kasing dami as nung nakita natin nung alpha, beta, and delta peaks natin. Bakit? Number one, Omicron is a less severe variant in comparison to the other variant of concerns. And if we can remember, this is the time na tayo ay nag-ramp up ng ating vaccination efforts at umaabot na to almost 70% yung fully vaccinated coverage natin sa ating total target population na mga gustong mabakunahan. So those two things actually led to a slightly smaller proportion of severe, critical, and hospitalized among our total cases. And after that Omicron peak, makikita natin na malaki talaga yung ibinagsak na ating mga kaso as we're also observing in previous peaks. Pero tulad ng pinag-uusapan natin, habang tayo ay nagtatransition mula sa pandemya towards what we want, which is endemicity, makikita natin na meron pa rin tayong makikitang pagtaas sa mga kaso. These slight increases or these spikes in cases are because we're getting more mobile, we have more social gatherings, and as we ease further our restrictions, makakakita talaga tayo no ng mga pagtaas ng kaso. But as we have observed, mula nang nagkaroon tayo ng bahagyang pagtaas ng kaso noong July of 2020, hindi na siya umabot even doon sa dami ng alpha, delta na number of cases natin. At ganun din no, para sa ating admissions. Meron pa rin kasabayang pagtaas ng admissions noong nagkaroon tayo ng peak nitong nakaraang mga buwan, subalit hindi na siya umaabot sa dami ng hospitalization na nakita natin ng mga naunang peaks natin. So we call this decoupling, and this is really one of the impact of the fast tracking of vaccination that we've done, not just for our total target population, but because we prioritized the vulnerable. And of course, these are the elderlies at yung mga may comorbidities natin. Next slide, please. So the value of vaccination is also shown no, in this graph kung saan nakikita natin na yung red line, which are the discharges na hindi fully vaccinated, at ikukumpara natin doon sa mga discharges natin na nakakumpleto ng ating primary CPs, ang proportion ng severe and critical among those who were not fully vaccinated were almost twice higher, no, at around 7%, than those who were fully vaccinated, which did not even reach 4%. So ang gusto natin, well ngayon, no, mas maliit nga yung proportion ng mga nagiging severe and critical among those fully vaccinated. Gusto natin, di ba, lumaki yung gap, no? Mas lalong pumunti pa yung mga nagiging severe and critical among those who have been fully vaccinated. And that can really be done by not just fast-tracking our primary series, no, na deployment, but also availing of our booster doses so that we get no, that higher protection from these additional vaccine doses. Next slide. Next slide, please. Kaya naman, sa pag-uusap na kung nagbabago ang ating goals, nagbabago din no, yung nagkakaroon din tayo ng shift sa ating strategy. So I will not belabor the point that Dr. Wong has mentioned that in this COVID-19 response, in this new phase, we really need to put a lot of effort into improving our vaccination. But we cannot discount the value of non-pharmaceutical interventions such as masking. And as we're also easing no, our masking mandates, the value that there is better no, or improved ventilation in these indoor spaces no, to compensate for whatever increased risk there may be because we have started to remove our mask mandates. And as previously mentioned, we don't see no, these lockdowns, these community quarantines are as primary interventions as we see probably additional case increases in the future. Next slide, please. At para malaman natin at ma-measure natin kung ang ating mga strategies no, ay sapat no, at effective, meron tayong mga tinatawag nating metrics. No? Dito, ginrupo natin itong tinatawag nating metrics or indicators into two. The first are those connected to our alert level system, which is our public facing. No? So, palagi nating inihahalin tulad ang ating alert level system to a typhoon warning signal. It's there to provide guidance to individuals, to government units, to our agencies, para malaman ano ba yung risk natin no, in relation to COVID. Nakikita natin na habang tumataas ang alert level classification, tumataas ang risk natin. Hindi lamang risk na magkaroon ng COVID, pero risk din no, na dumami ang hospitalization or mapuno ang ating mga kama. Kaya naman, ang ginagamit nating metrics dito, pangunahin or pinakamabigat yung tinatawag nating total bed utilization rate or ilang porsyento ba ng mga COVID-19 dedicated beds natin ang nagagamit or na-occupy. Ikalawa dito ang ating average daily attack rate, which is talking about how large no, or how many cases of COVID we're seeing. And of course, the third, which is vaccination, which actually compensates for whatever case increases we're seeing. So sabi natin, kaya nating maka-accommodate ng mas mataas na dami ng kaso as long as number one, our vaccination coverages remain high or continue to get higher, or number two, we're not seeing a proportionate increase in our utilization rates. So these are our public-facing metrics, no, or indicators para masabi ano bang COVID-19 situation. But for the Epidemiology Bureau and the Department of Health, meron tayong tinatawag na internal monitoring. No? Ito ang mga indicators na pwedeng magsabi na, uy, may kakaibang nangyayari or posibleng mayroong unusual na pangyayari sa ating COVID-19 situation. Dito nakalista yung ating dami ng severe and critical admissions, yung ating mga percent increase, yung tinatawag nating 2-week growth rates. No? Doon din papasok ang pagbabantay ng ating deaths, kasama dito ang ating case fatality rates. Ang pinakahuli dito, yung ating positivity rate or the proportion of those who test positive among all those who are becoming or among all those who are being tested. Next slide, please. So I'd like to just spend a bit more time now talking about positivity rates since there's a lot of parang questions no kung paano ba natin ginagamit ang positivity. Dito, pinakikita natin ano ba yung naging trend ng ating samples, no? At ano rin yung naging trend ng positive individuals or positive tests among these samples. Bakit natin pinakikita yan? Because these are the two things that affect positivity rate. So, ano ibig sabihin? Kapag dumadami ang ating positive individuals, lalaki ang positivity rate. Pero, pwede ring lumaki ang positivity rate natin just because the number of samples that we are testing are also lowering, no? Or kumukonti siya, no? So, makikita natin na from a peak, no, of more than 90,000 samples, tayo ngayon ay nakakakita na lamang ng 11,736 RT-PCR samples per day, no, as of November 2022. So, malaki talaga yung ibinaba na ng tinetest natin. Bakit? Una, nabanggit nga ni Dr. Wong, nagbago na rin no, yung testing protocols natin. No? So, we're shifting from very PCR-centric to more of antigen testing. Ikalawa, nagkaroon tayo ng mas malawak no, na access no, to self-administered antigen tests. So you can choose to test yourself rather than going to a laboratory to get an RT-PCR. And at the same time, yung ating habit din na kung ako ay naging symptomatic, kung ako ay nagkaroon ng flu-like symptom at mild lang naman, I may choose not to get tested. But rather, I'll just isolate, no? And inform whoever I had contact with to also observe themselves. So itong mga pagbabago in our testing protocols and behaviors kind affects, number one, there's lower number of samples being tested, and number two, we'll likely get more positive individuals kasi yung mga mas severe form, no, or yung mga symptomatic ang mas likely, no, nagpapatest ngayon, and as such, mas likely nagiging positive sila. Next slide, please. So just to further, next slide, please. So just to further illustrate the point na posibleng magkaroon tayo ng parehong positivity rate, but hindi ibig sabihin na mas madami ang positive individuals. So in this graph, we're showing that in the period of June 20 to 26 of 2021, our positivity rate was 11.7%, comparable to the positivity rate for the week of November 21 to 27, 2022, which is at 11.8%. So almost exactly the same positivity rate. But if you look at the number of positive individuals, ngayong November 21 to 27, we only had 9,700 positive cases. But if you look at the same number, in 2021, we're talking about 43,449 positive individuals. So exactly the same rate, but we have less number of cases now compared to that time. So ano ba yung value ng positivity rate sa atin? It will not tell you how large the number of cases are. It will just tell you ano yung trend. Ibig sabihin, kapag lumalaki ang positivity rate, dumadami ang kaso na nakikita ngayon, ngayong linggo or ngayong araw na to, in comparison to the previous time period, no? So it's showing us that there's growth in our cases. So yun yung mga binabantayan natin na kapag tumataas ang positivity rate, gusto natin maintindihan. Talaga bang dumadami ang kaso and is it much larger than before? Or is it just because mas malaki ang ibinaba ng samples natin? At kung meron mang pagtaas ng kaso, gaano ba kalaki talaga yung pagtaas ng positive individuals na nakikita natin? So let's go on to the next slide. So, next slide please. So, kamusta na ba tayo ngayon, having talked about what are our goals and our metrics? Next slide, please. Pasimulan ko, no, talking about these variants, no, and our biosurveillance efforts. Gusto namin ipakita ng graph na to na magsimula noong December of 2021, no, mula nang lumabas ang Omicron, ito na nga, no, ang predominant variant globally, no? This is not local data. This is data globally of sequences being uploaded, no, to GISAID, no. Sa ngayon, among the Omicron's various subvariants, meron tayong 4, no, na binabantayan. Ito yung BF.7, BA.5.2, BE2.75, and BQ1.1, no. Let's go on to the next slide. And locally, ang nakita din natin ay naging Omicron na rin ang predominant na variant sa atin, no, mula ng December of 2021. So balit nitong nakaraang June until September, nakita natin, no, yung biglaang pagdami ng BA.5, and these are the medyo medium colored na purple, no, in this graph. At nitong mas mga nakaraang mga buwan, nakita natin, no, na dumadami naman yung BA2.3 natin at itong XBB, no. So BA 2.3 are the very light colored bars here, and XBB are these light yellow bars, no. So nakikita natin na Omicron pa rin, pero may mga bagong subvariants, no, or variants na lumalabas. Gusto ko lang i-clarify na lahat ng variants na nakikita natin, wala tayong bagong variant of concern na dineklara ng WHO na naobserbahan either globally or locally. But do note that these variants have been, there is initial evidence that this could be more transmissible or immune escaping. So next slide, please. And so globally, what has been the effect? Consistent ba yung epekto, no, ng discover or pagka-detect nitong mga bagong variants na po na sinasabing more transmissible or immune escaping? There's actually little consistency as their impact on case and hospitalization. So in this graph, pinakikita at kinukumpara natin na sa Singapore, which is represented by the red line, nakita, no, na nung lumabas ang BQ.1 at lumabas ang XBB, nag-translate siya actually, no, to number 1, higher cases, no? And these are the daily new confirmed cases on the left, as well as higher admissions, which is the graph on the right. Pero in the United States, we're actually 50%, no, of their COVID-19 cases is actually tested positive for either the BQ.1 or the BQ.1.1. Though there were some or slight case increases and slight increases in their hospitalization, it didn't translate, no, to significant increases. So anong ibig sabihin? Hindi kesyo may lalabas na bagong variant, magkakaroon agad ng pagtaas, no, ng either kaso or pagtaas ng hospitalization. So why is that? We'll talk about it a little bit later. So next slide, tingnan natin kung kamusta tayo ngayon sa Pilipinas. So unahin natin, no, kamusta ba yung ating estado sa ospital? So even with the detection of these new variants, what we're seeing here is not, there is no significant increase, no, in our hospitalizations, whether it's the total ICU and severe and critical admissions, hindi tayo nakikita, no, ng malaking pagtaas ng ating mga admissions. It has not reached the numbers of Alpha, Beta, Delta, or Omicron, no? Even with these recent case increases. Pero binabantayan actually natin hindi lamang ang ating COVID admissions. Pinakikita namin sa kanan na binabantayan din natin ang ating non-COVID admissions. As Dr. Wong relayed earlier, our excess mortality was actually among those who had non-communicable diseases, no? So anong ibig sabihin nun? Tayo ngayon ay nakakakita ng pagkapuno ng ating mga non-COVID beds because people now have the opportunity to seek consult, and yung mga dating mga kondisyon nila na hindi nila napapatingin or hindi nila na ipokonsulta, ito yung nagiging chance nila para ma-manage na yun. So, andun yung pagbabalanse natin na while we want to have enough resources to address admissions because of COVID, we need to balance that out. Doon sa nakikita nating increasing demand for non-COVID consultations and admissions. So, kailangan may sapat tayong resources, both COVID and non-COVID. And sa ngayon, ang mas pagkapuno na nakikita natin is actually for our non-COVID admissions. Next slide, please. And in terms of our cases, yes, no, in the National Capital Region, we recently saw a slight increase, and that is why our positivity rates increased for NCR and as such, also for the national level. Ganun din, may nakikita tayong pag-increase, no, or tinatawag natin positive growth rate in certain regions. But in this table, what you can see is pag green, ang mga utilization rate, anong ibig sabihin? Di ibig sabihin, lahat sila ay low risk lamang. Sabihin, hindi umaabot ng 50% ang utilization ng mga COVID-dedicated beds natin. No? Ang medyo may pagtaas lamang ng ICU utilization right now is in region 11 and it's at 60%. No? But other than that region, all utilization rates, both for total and ICU beds, have actually remained at low risk, even with these increases in cases that we have seen over the past weeks and months. Next slide, please. So, panghuli, gusto nating tingnan, ito yung ngayon. Ano ba yung pwedeng maging sa susunod na mga araw, linggo, or buwan? So we'd like to share here disease projections done by our FASTER team at pinakikita sa kaliwa yung ating posibleng national daily cases at sa kanan naman yung ating active case, and these are national numbers, no? So kung tayo, no, if our current scenario and if our current minimum public health standard compliance remains the same, posibleng makakita tayo ng tuloy-tuloy na pagbaba ng ating daily and active cases, which is represented, no, by this green line. No? We may see numbers, no, totaling to just around 429 by December of 2020. Pero ano ba yung dalawang scenario na pwedeng magkaroon tayo ng pagtaas ng kaso? And these are represented by this red line and the purple dotted line. This is if our MPH compliance will decline. So bakit mababawasan? Nabanggit natin, parating na naman ng holiday. So posibleng mas dadami yung magiging interaction natin. Lalong bababa ang ating social distancing. And of course, no, na babawasan na nga, no, yung ating compliance to masking. So if our MPH compliance further decreases, our daily cases will actually may probably range, no, from 1,114 to as high as 2,294 by the end of December. And our active cases may also reach, no, a total of 18,000 as of December. And these are national numbers. Next slide, please. Pero sabi nga natin, mas gusto nating tingnan anong magiging epekto, no, ng pagtaas ng mga kasong to sa hospitalization. Sa projections na ginawa ng ating partner, which is Autumn, kung walang papasok na bagong variant of concern, hindi natin makikita na dadami ang ating hospitalization. Again, pwedeng dumami ang kaso, but they will not translate to significant increases in our hospitalizations. But we are showing here two scenarios where we may see increases in our hospitalizations. And these are number one, the graph on the left is showing kapag may pumasok na isang immune escaping variant, or the graph on the right, which is kung more transmissible ang variant, posibleng makakita tayo ng pagtaas ng ating mga hospitalizations. But just to keep yung perspective natin, the highest number that we will see will be actually around 800 admissions, and these are NCR data. Perspective lang na nung Delta, ang ating highest number of admissions is around 1,270. Anong ibig sabihin? Yes, with a more transmissible or immune-escaping variant, our hospitalizations will likely increase, but it will not reach the height or the peak of Delta na nakita natin. And these are actually outcomes that we can prevent, as mentioned by Dr. Wong earlier. We can prevent that by increasing our vaccination. So in these projections, yung mga scenario which are represented by the green lines, makikita natin on the left that we have much lower admissions kung patataasin pa rin natin. The dark green and the dark or the maroon lines have lower number of admissions because we're able to increase our vaccination. And on the right, the dark blue and the tan lines also showed na kung patataasin pa natin ang ating bakuna, even if our hospitalizations increase these variants, it will be much lower than if our vaccination coverages were actually lower. So there is something that we can do to prevent severe outcomes and even fatalities resulting from an immune-escaping variant or a more transmissible variant. And to end, let me go on to my last slide with these paalala. Next slide, please. So again, ang mobility natin is already higher than our pre-pandemic levels. Social gatherings now will continue, and we will continue to ease restrictions. And as such, we really expect case spikes to occur. But this should not lead to any significant increase in our hospitalization and death. Our hospitalization rates and our admissions is actually a measure kung gaano ka-epektibo ang ating vaccination efforts. And also a reflection kung sapat pa yung vaccination coverage natin, either nationally or down to our local levels. Again, there are multiple factors affecting positivity rates. So when we try to describe the COVID-19 situation, using just that metric to describe our COVID-19 situation is not an accurate way to measure that. It's an unreliable metric. And we have never really been dependent on one metric alone to describe our COVID-19 situation. We need multiple indicators para mapakita sa inyo ang tunay na picture ng COVID-19 scenario natin. And yung pahuli nga, ngayon nagta-transition tayo, hopefully, dire-diretso na outside of the pandemic into endemicity. Our strategies will really focus on vaccination. Again, we need to maintain that high immunity wall, not just from ourselves, the reminder is it's not for me alone or you alone, but it's for your family, It's for your circles to ensure that everyone has that high protection so that we minimize these negative outcomes and we talk about admissions and fatalities that we would really like to further reduce. So, salamat, and that's the end of the presentation. Back to you, Nikki.
Maraming salamat, Doc Thea, sa pagpapaliwanag ng kasulukuyang kalagayan ng COVID-19 sa bansa at ang ating metrics at indicators ng ating alert level system. So before po tayo mag-proceed sa ating open forum, may we kindly call on Dr. Edsel to provide his synthesis of the discussion thus far and to further provide his insights and expertise sa ating pong topic for today. Doc Edsel.
All right, thank you, Nikki. I have 7 slides. Let me just share them really quickly. All right, so the title of this very brief talk is Endemic na ba? Which is really the question that everyone has. So ano ba yung endemic? Sinabi na nga ni Dr. Wong na that doesn't mean that's the end of the pandemic. Yung end doon means endo, hindi end. It does not mean COVID-19 is harmless. It only means we can predict the impact and we have the tools to control. So dyan nga yung vaccine, masks, testing, antivirals, these all have a role to play. Kung pwede lang natin ma-eliminate yung COVID, that would have been the ideal scenario. But once lumabas yung Delta, medyo hindi na talaga dahil sobra na siya nakakahawa. So ang endemic po is not a checkmate kasi elimination yon. This is more like a stalemate. In other words, ma-predict na natin pero hindi natin siya mawawala, ma-eliminate completely at this point. Napakita naman to pero siguro I just want to focus on these graphs. Nakita natin nung Delta, parallel pa rin yung increases in deaths. Pero nung sa Omicron, nung January, yung BA2 natin, bagsak na talaga yung number of deaths compared to the number of cases. BA.2 Omicron in January had almost double the number of cases of Delta, pero yung number of deaths niya is less than half. So doon yung point na tinatawag natin na decoupling. Hindi na ganun ka-deadly yung Omicron compared sa Delta. Not just because Omicron is less deadly, but because the bigger reason for that is yung vaccination campaign natin. And ito nga, nakita natin yung BA5 umakyat, bahagyang-bahagya lang talaga yung increase in number of deaths. So, since January 2022, pag tinatanong ako lagi, Dr. Salvania, endemic na ba to? Sabi ko, well, we started to see the move towards endemicity noong January 2022. Hindi yan, as sinabi ni Dr. Thea, hindi yan parang magpe-press ka ng switch tas endemic na siya. Hindi ganon. Continuum po talaga yan. And again, as Dr. Wong has also said, what is acceptable to the government, to the people in terms of the burden of disease. So yung vaccines at yung ating minimum public health standards are really mostly responsible for yung pagbagsak ng ating case fatality rates along with our treatment yung availability of good treatment options. Pero yung case fatality rate ng most people, especially those who are vaccinated and boosted, is already at the level of the flu. Except lang nga, itong ating most vulnerable, meron pa rin silang residual risk kahit vaccinated and boosted sila, which is above that of the flu dahil yun na rin po yung nature ng COVID-19 na ang pinaka-disproportionately affected talaga are the people who are 65 and above, people who are elderly. And then we saw this change despite the fact na sunod-sunod nga itong mga bagong variants, di ba? Yung BA1, BA2, BA4, BA.5, XBB, XBC. Tapos ito na naman, BQ1, BQ.1.1. And nakita naman natin sa projections ng Faster at ng Autumn na because of our vaccination, because we already know how to deal with this, hindi talaga aabot dun sa level ng Delta yung hospitalizations. And that even in the worst case scenarios, kahit may bagong variants pa man dyan, we've already done a lot of work in terms of vaccinating our population. And we continue to provide boosters. And yun nga, nakakatuwa is that a lot of people continue to wear their masks. This really does help, lalo na pag tumataas yung mobility. So, what do we expect? Yung seasonal variations, katulad nga ng sinabi ni Dr. Thea, yung merong up and down para nakikita rin natin sa ibang cases like sa dengue, ganon. Yung deaths and healthcare utilization will remain low as long as yung wall of immunity nga na sinabi ni Dr. Thea is maintained. And of course, very important, we pay attention to the utilization of the hospital beds and also the severe cases. The last few weeks, nakita naman natin less than 10 lagi yung new severe cases. And this is a testament na even though wala pa yung bivalent vaccines dito, yung monovalent vaccines continue to protect against severe disease, whatever variant that is, and it includes BQ.1. So yung bivalent, may nadadagdag lang yun in terms of prevention of symptomatic infection, but it doesn't mean that the monovalent vaccines no longer work. Additional protection po yung sa bivalent. And then masks can prevent outbreaks and decrease cases. And that's also why hindi rin nagsaspike kahit pumapasok pa yung mga variants na yan, kahit anong gawin ng variant, hindi talaga siya makakalusot pag lahat ng tao nakamask, even if our vaccines have less infection prevention capacity. And again, monovalent vaccines remain effective against severe disease. I want to keep saying this again and again and again kasi people keep saying, asan na yung bivalent? You're still protected. When the bivalent is there, fine, go get it if you want it, but it doesn't mean you're back to zero. Hindi po. Kaya nga, sustained po yung protection against severe disease. Bivalent vaccines will help decrease immune escape, and then hindi rin tayo helpless kasi kung yung virus nagmi-mutate, tayo rin gumagawa ng mga bagong vaccines. If you look at the WHO landscape of novel coronavirus candidate vaccines, there are 175 vaccines for COVID in clinical development and 199 more in preclinical development. So kung merong COVID variants, meron din tayong vaccine variants. And some of these are multivalent, some of these are intranasal na sinisquirt na lang, some of these are universal vaccines na hindi lang SARS-CoV-2 ang target, pati lahat ng coronavirus including MERS, SARS, and even the common cold. So marami po tayong panlaban dyan as long as we continue to use the tools that we have. So always question, should I still wear a mask? So ang sinasabi ko, okay, mask up if you're vulnerable, mask up when the cases are high, mask up if you're in a crowded area, mask up if you live with vulnerable people. And, you know, if you don't belong to any of those, mag-mask ka na rin if you want maximum protection. Very, very important. So take-home messages, COVID-19 is becoming endemic. And again, hindi yan isang day na sasabihin na magigising ka, ay, endemic na pala siya. WHO will probably make some sort of declaration like that, hopefully sooner rather than later, pero hindi pa nila tinuloy noong October. But it's on its way. And so, important, it doesn't mean it's not harmless, but it is manageable. The masks and the vaccines continue to protect us. Itong new normal natin, yung wearing mask is a personal choice. And, you know, keeping up to date with your vaccination. You do both of these, you will maximize your protection. And the masks just don't work against COVID. They work against respiratory illnesses, yung flu, yung RSV. Yung RSV po, respiratory syncytial virus, hindi po si OIC Verherian. Ito po yung umiikot ngayon sa mga bata sa Amerika, and meron nga sila tinatawag na tridemic, yung influenza, RSV, and COVID na nakakapuno ng hospitals nila ngayon. Ayaw pa rin nila mag-mask, hindi ko maintindihan. Hand hygiene pa rin ba? Hindi. Importante po yung mask. So, we will have a good Christmas if we continue to protect one another. Thank you po.
Ayan, maraming salamat po Doc Edsel sa pag-highlight ng ating minimum public health standards at pagbabakuna ang ating kailangan para sa ating unti-unting pagpunta sa endemic state. Ayan, so before we proceed to our question and answer portion, we would like to let you know that we will try our best to accommodate all the questions but may be limited due to time constraints. So before we start po, may we once again remind our media partners to please stick to the topic and to raise their questions in the chat box. So para po sa una nating tanong, mula kay Donna Pazibugan ng Philippine Daily Inquirer, para po kana Doc Thea, Doc Wong, and Doc Edsel, what policy changes will be implemented once the public health emergency is lifted? May we know the specifics like changes in quarantine and isolation, free vaccination, on the no vaccine, no on-site work, on insistence to use antigen test as screening, full on-site work po?
Sige, Nikki, no? I'll try to answer, no? Sa ngayon, wala pa tayong pag-uusap, no? Kung ano ba talaga yung mga definite na policies na mababago or ano yung bagong policies natin. Kasi I think tulad ng napag-uusapan natin earlier, yung unang kailangan masagot na tanong ay dapat na bang i-declare natin na tapos na yung public health emergency? And that will actually equal to us saying na, uy, from pandemic, endemic na kasi si COVID. But definitely yes, no? When we lift our public health emergency declaration, it will also mean further easing or siguro another term will be de-escalation, no? Doon sa ating mga testing and quarantine protocols. Ano yung possible na epekto, no? Hindi titigil lang pagtetest because we need to conduct confirmatory testing for purpose of surveillance, no? Para lang pag sa influenza or yung nabanggit kanina ni Dr. Edsel sa RSV, nagpo-confirmatory testing pa rin tayo. So, tuloy-tuloy yung paghahanap ng kaso at part nun ay ikalawa, paano gagawin natin, no, pagkatapos nating matest, no? Or even kung hindi tayo mag-test pero symptomatic, required pa ba yung isolation, no? So yan yung mga dapat pag-aralan with our experts. If number one, do we require and how long, no, ba natin dapat i-require yung isolation? Pag tumingin kayo sa policies ng iba't ibang bansa, iba't iba din, no, yung policies nila. Merong iba na 3 araw na lang, yung iba 14 days pa rin, no, yung kanilang mga policies. Siguro yung ikatlo at maging mayroon ng malaking naging epekto yung mga border control policies natin. So kung dati nagre-require tayo ng test on arrival, quarantine or on arrival, nakita natin yun ay nilift na rin natin. At throughout all of these discussions, gusto ko lang ipaalala na malaki ang magiging epekto ng bakuna natin, no? Yung coverages ng bakuna natin to determine what will be the appropriate, no, the kumbaga sapat at dapat na magiging policy natin so that we minimize risk for more severe disease and death to as large a number of our population as possible. Kasi na Dr. Wong or Doc Edsel ay further in this.
Doc Wong, Doc Edsel, may gusto po kayong i-add sa sinabi ni Doc Thea?
Sige, I'll go first. What I would recommend is government should still offer the vaccination for free, and still motivate people to get vaccinated, especially for the primary series. Second is not as a mandate, but government should still continue to encourage people to mask. It's an easy thing to do naman so why wouldn't you do it to protect yourself and to protect other people, So one of the findings from the excess death study from the PSA data is that pneumonia cases went down, dropped by about not cases but deaths, there was a decrease of about 40,000 pneumonia cases over the past 2 years, but there was no mass vaccination with pneumonia vaccine or any changes to the pneumonia program. So we can attribute this to masking alone. So it prevents you, it doesn't just protect you from COVID, it protects you from other respiratory illnesses also. So those are the things that we should probably continue to encourage people to get or to receive. Thank you.
Maraming salamat po, Doc Wong. Doc Edsel?
Yeah, siguro just one quick thing na alam ko inaabangan ng mga tao is really, as Director Thea has said, when are we going to stop isolating people who are positive? And the important thing there is, ano ba yung threat ng isang taong positive? Makakahawa siya ng maraming tao. But one way to reduce that talaga is masking. Mag-mask yung taong nag-positive and the people around them. And so actually, we were already starting to think about that, but then we lifted the mask mandate. So mag-i-increase yung risk if we remove the isolation protocol. So we'll have to see how to more or less neutralize that added risk. Talk about it. Kasi malaki rin ang burden. Alam mo, mag-positive ka, 7 days out of commission ka. That's a real economic burden, especially for people who cannot work at home. So I think that's one of the things that we really have to sit down and talk about, especially the fact that we're already going down on our MPHS, including masking.
And thank you po, Doc Edsel, Doc Thea, and Doc Wong. Para naman po sa susunod nating question for Doc Wong, with the emergence of new variants, may projection na po bang DOH kung kailan maaabot ang endemic stage ng COVID-19 sa Pilipinas? Kailan po kaya ito mangyayari? And with the presence of BQ1 subvariant in the Philippines, may updated projections po ba sa daily COVID-19 cases nationwide? In Metro Manila, how many po?
It's actually difficult to make projections kasi projections are made based on a lot of assumptions. And some of those assumptions can turn out not to be true. So, and then the second thing is that the way the virus behaves is only one among many factors that will dictate whether cases, hospitalizations, and deaths will increase or decrease. As I said, endemicity is not something that will just happen to us because of the virus. It's something that we need to do. Vaccination, ventilation, and improving primary care. Thank you.
Thank you, Doc Wong. Doc Thea, Doc Edsel, may nais po ba kayong i-add sa sinabi ni Doc Wong?
Yeah, I think pinakita naman ni Director Thea yung autumn projections. That actually states that there's going to be a new immune evasive variant. Maybe yun yung BQ1, baka mas malala pa sa BQ1. And kita naman natin, hindi naman talaga lalampas ng 3,000 cases per day yung projections noon, and also hindi rin lalampas yung healthcare utilization anywhere near what we saw in Delta. So I think based on those projections, even if may pumasok na bagong variant, we're not back to zero at all.
Siguro, Nikki, ang dagdag ko lang, kasi parang we're so focused on us being able to tell, ay endemic na bukas or sa Wednesday or sa susunod na linggo. Pero honestly, no, pag naging endemic ang COVID, yung ginagawa natin ngayon, a lot of the things are actually the same things we still need to do. Kasi ang mangyayari, pag hindi natin tinuloy yung mga naging gains natin, which is actually for me, from a not usually a mask-wearing country, natuto tayong mag-mask. That's number one, no? Natuto tayong mas maging conscious na, uy, may symptom ako, dapat mag-isolate ako, dapat iwalay muna ako sa mga kasama ko sa bahay. So there's improved health-seeking behavior, no? And I guess more conscious and I hope more healthy behaviors din. And we also saw the value na dapat maganda yung access natin, no? The primary care services, kasi that's really your gatekeeping para hindi na mas maging severe and critical. So all of these things that we learned and have done during the pandemic, ang ibig lang sabihin pag naging endemic, alam natin kung ano na yung itutuloy natin. Kasi ayaw natin na from endemic maging epidemic na naman siya and another pandemic. That's all I'd like to add that talk about when will we endemic.
And thank you po, Doc Wong, Doc Edsel, and Doc Thea. And again po to our media partners, apologies. The next question would be our last question na rin po due sa ating time constraints. So para po sa ating last question mula kay Red Mendoza ng The Manila Times, para kay Doc Thea, with the decoupling of the restrictions to the alert level systems, does that mean na mawawala na yung mga percent capacities on specific settings? I-enforce pa rin ba ang mga mandate or would it become optional na lang? Dr.
Yeah, thank you. No? Kasama to dun sa nabanggit ni Dr. Edsel na pinag-uusapan natin. No? Dati, malaki talaga yung naging use, no, as a tool ng alert level system natin. But right now, we're also seeing na, uy, baka bago na yung maging role ng alert level system natin. From something that will dictate what you should do, kung ilang porsyento lang dapat ang laman ng isang restaurant, kung kailan lang pwede may mass gathering, kailan tayo mag-travel. Now we're really seeing, no, a shift from dictated or enforced na regulations to more of us making this risk assessment, no, and deciding ano yung dapat natin gawin. Magiging guide naman natin siya to make those decisions. No? Ano ba yung risk ko? Ano din yung risk ko sa mga kasama ko sa bahay at sa trabaho. So that's something we need to discuss and something na we're also seeing na magiging direksyon na natin. It's a communication tool. No? So I'm in Korea right now. And you know what they do here in Korea? Kapag biglang nag-jump ang kaso or tumaas ang hospital admission, they send out messages, no, to the public. Wala silang sinabi na, uy, magtago kayo sa bahay. Uy, dapat lahat kayo mag-mask. Magla-lockdown tayo. Walang ganon. Sinasabi lang, etong estado ngayon. Now, you assess for yourself. Anong risk mo? And as such, ano yung dapat mong gawin at ano yung i-advise mong gawin sa mga kasama mo. So, that entails a lot of us being aware and knowing what's going on and also what we should do to protect ourselves.
Thank you, Doc Thea, all the way from Seoul. Doc Wong, Doc Edsel, may nais po ba kayong idagdag sa sinabing Doc Thea?
Nikki, I'll just say something.
Sige po.
Yeah, so as I said, when we talk about endemicity, we should also think about it's endemic for whom, no? Kasi it can be endemic for the vaccinated, no? It can be endemic for people who have no comorbidities, no? Pero it can still be dangerous for the elderly and for people who have comorbidities, no? So we have to take the steps to make sure that even those people, no, the vulnerable, are protected, no? If we are ever to, if we are going to end yung mga health emergency policies. Thank you.
Maraming salamat po, Doc Wong. And before we conclude po, again, may we request our experts to give the reminders and messages to our media partners and to the public. At uumpisahan po natin kay Doc Thea.
Again, no, salamat sa ating media partners. You're really invaluable, no, in putting across the messages that we'd like not to share to our public. And I guess from me coming from the Epidemiology Bureau, what we'd like to remind is now that we're shifting, no, yung pagbabantay natin ay hindi ng ating COVID-19 situation, hindi na lamang siya pagbabantay na ginagawa ng Department of Health. Kasama tayo, sabi nga kanina, no, it's a shared responsibility. And as we assess, no, the COVID-19 situation, we need to look at various metrics. No? So we're shifting now from very case focused to more of looking at hindi sana napupuno ang ospital, hindi nagkakaroon ng pagtaas ng kaso pag tinitingnan natin ang COVID-19 situation. And because we want to avoid these severe outcomes, andun palagi ang pagpapaalala na number one, pagpabakuna po tayo. No? Hindi lamang bakuna na first 2 doses or primary series, napakahalaga ng pagpapabooster, lalo na tuloy-tuloy no, yung emergence sa mga bagong variants na posibleng magkaroon ng negative impact. Ikalawa ay yung nabanggit ko kanina na wag sana nating kalimutan yung natutunan natin no, sa COVID-19 pandemic. Ang halaga ng pagmamask, ang halaga at mas malaki no na appreciation na dapat tama ang ventilation no and yung agaran na napagpapatingin to ensure na we minimize as much as possible these negative consequences. And I think yung third no is sana as we go on to reach or sana pag-abot no sa pag-uusap natin sa endemicity no sabay-sabay tayo no na magtulungan para maabot na nga natin yon, and that requires us no sharing the responsibility for ourselves and for those around us. With that, thank you.
Maraming salamat po sa mga paalala, Doc Thea. Doc Wong?
So, to enjoy the holidays, no, I encourage people to follow you. The 3 out of 4 rule. No? So this is vaccination, ventilation, masking, and distancing. No? The easiest to do are vaccination and ventilation because once you do it, you can forget about it. No? They will protect you in the background. No? So just worry about distancing and masking. No? So masking is the easiest one to do no? During these holidays. Thank you.
Maraming salamat po, Doc Wong. And Doc Edsel?
Yeah, so thank you, Nikki. Thank you to everyone who attended. It really looks like it's going to be a good Christmas because people are doing the right thing. Ako natutuwa ako. Alam mo, nangyayari ngayon sa China, dumadami yung cases, although yung peak nila is 40,000 cases. Yung sa US naman, 40,000 yung daily cases nila ngayon. So what I'm saying is, sobrang extreme talaga yung ginawa ng ibang tao eh. Yung China, nag-zero COVID policy sila. Yung US naman, konting bumababa lang yung cases, tinapon na nila yung masks nila. Sa Pilipinas, ang ginawa talaga natin is science-based. We balanced our economy, our health, and everything. And ako natutuwa ako, the Filipino people themselves are really disciplined in doing this. We told them, okay, it's been 2 years, so we're gonna start lifting this mask mandate. People still kept their masks on kasi nasanay na rin sila and alam nila na proprotektahan. So for me, I'm very, very hopeful that people already know what to do. And that's the key to endemicity, because if you're going to learn to live with a virus, then you know the right thing to do, and that's to protect each other. Thank you.
Ayan. So muli maraming salamat po sa ating mga experts today, sa ating mga katuwang sa media at sa bawat one at one ang nakasama natin sa talakayang ito. So bagaman nagbaba na nga po tayo ng restriction sa ating masking mandate, hinihikayat pa rin po natin ang publiko sa pagsunod ng ating minimum public health standards, kasama na rito ang paghugas ng kamay, pag-isolate kung may nararamdamang sakit, at higit sa lahat ang pagpapabakuna at pagpapabooster. Muli, isang Juan na mula sa Kagawaran ng Kalusugan. Ako po si Nikki Nesasario. Magkita-kita po tayo ulit sa susunod na Kapihan session. Maraming salamat at mag-ingat po tayong lahat para sa isang healthy Pilipinas.
Thank you, Doc Esther, Doc John, to the comms team.